My name is Dr. Kolja Sievert and I work as an interventional cardiologist at Cardiovascular Global, and I would like to explain to you what a patent foramen ovale or PFO is, why it is relevant, why closure can be important. What is a PFO? So a patent foramen ovale is an opening between the upper chambers of the heart called the atria, and this can remain open in certain patients. And many patients never have symptoms due to this, but in some patients this can cause strokes. So when does a PFO matter? A PFO only matters when it allows a blood clot to pass from the venous side of the heart to the arterial side of the heart, because then it can pass into the brain and causes stroke. So who benefits from closure? In patients with an embolic stroke and a relevant PFO, closure is an evidence-based treatment option. In the early studies, they focused on younger patients who had a stroke due to PFO, but even in older patients who had a stroke, if the PFO is considered as the causal role, then closure can be considered. In patients without prior embolic events, PFO closure is not the current state of the art. However, in some select cases, closure may still be indicated. So what closure options are there? There's not just one way to close a PFO. There's the option to use devices to close a PFO. It's possible nowadays to close a PFO using sutures, and also in some select patients, using bioresorbable devices may be an option. It really depends on the anatomy of the patients, on what options are available to that individual patient. So what about migraine and diving? So some patients with migraine have reported improvements regarding the migraine after PFO closure. So while closure of the PFO is not the standard of care yet, this may be considered for some patients. Now regarding divers, it's a bit of a different situation because a PFO can increase the risk of a decompression illness. So after careful counseling, PFO closure for certain divers may be indicated. So what about the safety as well as the recovery after PFO closure? PFO closure is a low-risk procedure in experienced centers and serious complications are very rare. It's usually performed as an outpatient procedure, so you return home the same day. At Cardiovascular Global, we focus on individualized decisions, on second opinions, and transparent discussions of all options with our patients. So we look forward to hearing from you.